do is I would inject numbing.
All right, Dr. Emer, we are live.
So you guys, we are here with one of my famous clients. We love her. She's looking amazing today. And we are doing Plasmamd to tighten the skin around her eye. And she's being a trooper right now because there's a little bit of pain always with Plasmamd. You guys can see we are making these little dots on the skin, and what I'm doing right now is this is what I call the Madonna Lift, okay? This is where you go right at the edge of the brow and get it to tighten right there in this sort of arching pattern. We're basically filling this in. Now remember, the Plasmamd, you guys, does not touch the skin. This goes right on the surface. Now she'll feel a little. And what we do is, what's key about this is having enough time to contact. So you want to not go too long on the skin, but enough to where we just get that little scab to form. And I can actually even see with my goggle that the skin is starting to tighten. Now if you want, why don't you just put a little bit of numbing cream on the bottom, like right here, just slightly, while I do the rest of the top. All right, I'm going now to the middle of the eye. What are they saying now? Are you gonna be okay?
I have a lot of people joining right now. I'm sure we'll get some questions coming in. Plasmamd is very popular.
So what I'm gonna do is, yeah, exactly. So what we'll do is we'll just put here, I can see it a little closer than you. Just gonna put a little bit more here. Since we're on live, I can give it a little more time. My big thing is just don't open the eye because you don't want to get any of the numbing cream inside. Okay, good. So we'll let that sit for a second. And then usually what I do is I kind of mark the area. So I'm gonna let her feel, because she's gonna feel this a little bit. And again, remember, we're not puncturing. Good. We're just going right on the surface.
Which pen is the doctor using? Because this is
Plasmamd, guys.
There you go.
Plasmamd, one of my favorite pens. Now, what's key, you guys, is not necessarily, it's gonna feel weird on her eye. She's gonna feel twitchy a little bit because the muscle contracts. You see how each spot, I'll pull away so you guys can actually see more of the electricity. Sparks an electric spark, you see it?
Yeah, we see that.
That doesn't even touch the skin. The needle doesn't. Just the sparks do. And shine back. She's doing quite amazing. She's already halfway done with her eye and doing really good. And the key is even spots.
How does this work on more pigmented skin?
Well, the key is the skincare. And afterwards, you really need not only retinol and hydroquinone, you need stem cells, anti-age from cosmetics.com, plus the brightener and the serum. And then also my refit face and eye, because those are peptides and growth factors. And then the key is all these little dots form basically little holes that need to exfoliate. And those holes will lift. I'm gonna show you guys here now, without the light.
And if you guys look on our feed, you'll see some amazing results of Plasmamd mixed with our Aerify kit.
Now I'm doing a more aggressive treatment, meaning you see that there's a lot minimal spacing, okay? Up here, there was more spacing, you see? So it depends. What the aggressiveness really means is how long the little dots will be there and how much tightening she will get. The closer they are and the more you hold on the skin during the treatment, the more tightening we're gonna get.
How many sessions will she need for this?
I always tell people 3 times in a year will give you a really good result. I have some clients that do more, I have some that do less. And honestly, even in one, we're gonna see it. We're gonna see results. So that's halfway done with the eye of an upper. And I always hold a little bit. Okay, we're gonna start now on the other side, I'm sorry, more sensitive. Because the eye wants to contract the muscle. You don't need an eye shield because this is superficial plasma. It's just gonna feel weird on the eye. Not gonna harm her eye. And you see how when I showed you guys before, I'm gonna start in the corner here a little bit. Always have to, after a little bit, take this little
Show
char
them
off
without the
and
light.
show them little dots
There you guys go. These are all the little dots the doctor has made.
that are forming.
What does our session cost on average?
On average, most areas are $1,000 to $2,000 a treatment, depending on what areas you're doing. That's the typical, to be honest, because takes a long time. You have to be very meticulous. And some people, the area is a little bigger. Like here, we have a little more skin, but I'm going I'm going very close. A lot of doctors go much further, and they don't have as much downtime, but the result isn't nearly as good. I also do what's called a horizontal or vertical pattern. Some people do a zigzags where they go like this. They do in between, like a checkerboard. I don't think the results are any different. I actually think the downtime is less and you don't see as much. Almost there. Especially this corner area, you really want to do this because we want the skin to tighten.
They're asking who is not a good candidate for this.
Super, super, super dark skin would need to be very cautious, or people who have eyelids that don't have looseness. If you don't have looseness, you don't really need this because you don't want to pull the eye when you don't need to tighten it. But even young people that have pigmentation, a little bit of wrinkling, crinkles, if you do Botox and you get an eye droop, these are good candidates. And if someone doesn't want to do laser and they want to have less downtime, almost. Perfect, we're almost there. So I have to do one more row on this midline, bear with me, hold on. Now you can do nerve blocks, it's just,
Does this boost collagen?
yes, it's just people get way more swollen. Perfect. So that's basically done. And do one more layer, hold on, one more row across here, just to kind of make it all even. You can see we're also getting some sunspots on her lid. There we go. She actually has some sunspots here, see? We call these little keratosis or lentiginous. Now lower is much easier, so I always do the worst part first. I just fill in some gaps because I want her to get a little more tightening here in the brow. And that, otherwise that looks perfect. And turn a little bit this way. Can you guys wipe now the lower part of her? Don't open your eye yet. Show them at least the upper being done.
Give them a pan of that.
And then I'll show a little on the crows and then that will be good. But yeah, and then wipe her with alcohol and water. Don't be shy, go over the whole eye. Get it all, just keep her eyes closed. Good. So we just did a very big area, which is great. What are they saying on there, Jordan?
A lot of stuff in 4 languages. How long is her recovery time?
3 to 5 days is typical recovery for this, with little dots that are there. All right, now what I'm gonna do, I'm just gonna outline where I wanna go. She's gonna feel it, but it should be a little better than the upper. You're gonna feel me pushing on you, I'm sorry, a little bit. This is gonna get sort of the crinkles. This is really good for people who have what we call Mallard Bags. What are Mallard Bags? Those are where the eye looks puffy underneath. And that could be due to genetics, that could be due to filler, that could be due to loose skin. Now we're treating the crows. Crows, no moas. Gotta get rid of those guys. Perfect. Remember, crows radiate out.
Will this also lighten skin color?
Not really, this shouldn't change the coloring. If anything, if there's pigmentation issues, it should get rid of them. And that's why dark circles really works well. All right, so now what we do, we're gonna start at the bottom. She's gonna feel a little bit, but it shouldn't be nearly as bad as the upper. Same thing. Following the row.
What creams do you use after this session?
Well, actually, so talk to them about that, you guys. Maybe Nisha could step in here. It's very important for me. I need to switch with you guys a second. Can you turn onto this side? Can you guys come over here? So I can go over here. Perfect. So it's very important with skincare afterwards to treat this like an aggressive laser. So what we do is we use anti-age serum, brightener, and my Refit Face and Eye, along with Silogen, which is a silicone-based cream. Jordan, you can tell them where to get everything, or they can contact Nisha to go over my protocol.
You guys can get everything and more on emeragecosmetics.com. You can also get a consultation on there, virtual or in person, for this treatment and many others.
Yeah, so if you're getting this treatment done elsewhere, we can guide you on what to use. Also, you can even apply my Aerify kit the day of, or even right when they peel, when these little dots peel, to even boost more collagen and help wrinkles. You almost get like a laser-like effect. Okay? And so we would use that at least twice a day. I add in my Hyla B serum, my AOC, twice a day. Sun protection, basically there. I'm going all the way up, guys. See how meticulous? Now, cleansing this is really important. So using an enzymatic cleanser like my enzyme polish, and even putting a Skinzyme mask on, or the vitamin C mask from Nude Skin, would be very useful each night to help us heal.
And for those of you asking for cost, you need to get a consultation with us. You can do that on emeragecosmetics.com. Or you can send us a DM with your full name, email, and phone number.
Last row, trying to not get any of these eyelashes. You see how superficial and how high we go. Let's wipe right there a little bit. And now I'm gonna do a little bit more of the row. I'm gonna balance. So she has crow's feet out here, so that's why we're extending. Now I'm blending. Call it extend and blend. Went down just a little. She's basically done.
If someone has a scar, is there any other treatment besides laser they can get?
Yeah, it depends on the scar. We have to take a look. This might even be a treatment, you know, micro rolling, needling. There's a lot of options. Peels. Basically done. Just blending the edges. Beautiful. Amazing. Okay. So this side's done, so you guys can show them really quickly what it looks like. Open your eyes and look all the way up for a second. I just want to make sure. I know you don't have to stare at the eye or at my goggle. Just doing little spots right inside the crease. You guys are now seeing an enhanced version of her pretty eyes because you can see with the light. Perfect. Okay. And then that's it. Hold on 1 second. You guys can take a look without the light. And then we now get an ice pack for her on the one side. Okay. She'll hold it on there while we do the other.
Anyway.
That looks really, really good.
Thank you.
So take a few seconds, I'll be back. So that's it, you guys, for Plasmamd resurfacing. I love it around the eyes. You can see all the little dots here. And all this is literally just going to tighten over the next few weeks. All right, you guys stay tuned for follow-up. Bye.